the pelvis is crooked, so the most common finding is that one side of the pelvis is higher than the other side. And also, because the pelvis is no longer level, as in this case, the leg length ends up different. So one leg ends up shorter than the other one. The whole, when the pelvis is not level, if your spine were still straight, your head would end up over, in this case, over on the left side. So to get the head level and also straight, so that your eyes and your balancing mechanisms can function in a normal way, the spine has to accommodate. So we end up with the spine ending up with curves, usually a curve in the lower part of the spine one way, changing direction in the chest cage region, and then changing again in the neck. So typically there are three curves in the spine, and it creates stress points where this curve changes direction, like in the low back, the mid back, and at the base of the neck. These are the areas that most likely become painful. The other area that's most common site to become a problem is the sacroiliac joint. Here's the sacrum and tailbone, and there's the hip bone on each side. And when the pelvis is crooked, it puts more stress on the joints themselves, the sacroiliac joint here and here, and the ligaments that tie the joint together, and the muscles that run across the joint. And any of these structures become a source of pain. So typically the pain is off to the side, not in the center, but off, overlying just the sacroiliac joint to the right or left side or both. Now if we look at another model, there's the pelvis, that's all crooked. It's higher on, in this case, the right side and lower on the other. It's exaggerated, I realize, but it's putting stress on the sacroiliac joint right here. This is the sacrum and tailbone, and everything is crooked. And secondarily, the spine compensates by forming these curves, so just to ensure that the head will end up in the center at level. One way is that you end up with one side tilted up higher than the other. For example, if you were to jump off a chair and land on your right leg, which is attached here, it could drive the pelvic bone upward this way, and it could get stuck in that position. And that's known as an upslip. So with walking, there's a natural movement of the pelvic bones forward on one side, backward on the other, and then the opposite direction as we keep walking. And for some reason, the pelvis can get stuck on one side rotated forward and the other one backward, or the opposite direction. And that's known as a rotational malalignment of the pelvis. And that's the most common way the pelvis gets stuck in an abnormal position. The last position that's abnormal is that as we walk, our pelvis goes forward with the leg on one side and backward on the other. When the right leg now swings forward, the pelvis moves forward and it moves backward on the opposite side. For some reason, it can get stuck forward either on the right side or on the left side. And that's known as what we call an outflare, inflare. When we talk about correction of the pelvis, let's look at how you can correct the most common way it goes out of alignment, which with one side rotated forward and the other one backward. So for example, in this model, if the right side is rotated forward and the left one backward, we want to rotate the right one backward again. And there's a muscle, the glute, the buttock muscle, that's attached all along the rim of the back of the pelvic bone. It brings your leg backward when you're standing and your leg is free to move. But if you yourself or someone stops you from trying to move the leg backward, this muscle is now contracting, pulling on this bone and pulling it backward, which is the way we want it to go back into its proper place. On the other side, the pelvic bone is usually stuck in the opposite direction, in this case backward. And there's a muscle, which is shown just on the right side on the model. On the inside, the iliopsoas, part of it is attached to the inside of the pelvic bone. What this muscle does is bring your leg forward, swing it forward. But if we stop the leg from swinging forward on the left side, this muscle is now working to pull on the pelvic bone and pull it forward the way we want it to go in order to get back into its normal position. So simply using your own muscles can, in a large percentage of people, rotate these bones backward.